Hi, my name is Espinosa, and this is the complete head-to-toe assessment. Okay, so first thing we do is wash our hands. Make sure our patient knows we are practicing hand washing. We're going to introduce ourselves to our patient. Hi, my name is Christine. I'll be your nurse today. I'm going to be doing your head-to-toe assessment. And we're going to correctly identify the patient. We're going to make sure that their information is correct. Is that correct? Okay, perfect. Are you ready to get started? Okay, so we're going to start with the head assessment. We're going to look at the face and make sure that the head and the face are symmetric. We see the palpebral fissures and the nasolabial folds are symmetric on the face. We're going to palpate the head and scalp. Is there any pain or tenderness when I'm palpating? Okay, the hair is clean and neat, and there's no lesions or masses noted on the scalp. Next, we're going to move down to the mouth, the temporal arteries. We're going to palpate them, and we feel the pulsations are normal bilaterally. Then we're going to palpate the temporal mandibular joint. Open and close your mouth. Okay, any pain or tenderness? And the movement is smooth and easy. Then we're going to ask the patient to clench their teeth. Okay, and smile. Puff your cheeks. Okay, now squeeze your eyes tightly shut and wrinkle your forehead. Okay, and that was the cranial nerve 5 and 7. Then we're going to test the extraocular eye movements, which are cranial nerves 3, 4, and 6. So I'm going to have you keep your head steady and just follow my finger with your eyes. Okay, and the other side. Okay, perfect. And now upon inspection, the eyebrows are also symmetrical and the eyes are free of redness and discharge. Do you have any discomfort in your eyes? Okay. So now we're going to do a visual fields by confrontation test. What we would do is be at the patient's same eye level and about an arm's length apart. We're going to have the patient cover one eye and we will cover the same eye. Then I'll have you tell me when you see my finger in the field.
No.
Okay.
No. No.
Okay. Opposite.
No. No. No.
Okay. Perfect. Next we are going to dim the lights and shine a light into the patient's eyes to check the pupils. We want to make sure that the pupils are equal and round and they're reacting to light and accommodating. And next we're going to perform an ear inspection. You can turn your head. We can see from the outside that the ear is clean. It's free of any lesions or cracking in the skin. And if we want to inspect the inside of the ear, we can pull up and out and shine a light inside. We can see it's clear of earwax. Do you have any hearing issues? Any earwax issues? Okay, perfect. Then we're going to perform a nose inspection. We can see the nose from the outside is clean and free of any lesions. We're going to palpate the nose. And the nose is symmetric and there's no break in the contour. Do you have any pain? Okay. Next we're going to check for nasal patency. So we're going to have the patient close one nostril and breathe in and out. Okay, and now the opposite. Okay, so the nostrils are painted on one side is a little occluded, which can be normal with any allergies or sinus. Next, we're going to move on to the mouth. We can see that the lips are moist and pink and they are free of any cracks or lesions. Can you smile? Okay, the teeth are clean and evenly spaced. The gums are pink and moist. Can you show me your tongue? Okay, color is even throughout the tongue and it's pink and moist. Can you move it up and down, side to side, and poke your inside of your cheeks? All right, perfect. Any difficulty with those movements? Okay. Can you say ah?
Ah.
We would use something to hold the mouth open, and then there's a rise and fall of the uvula noted. And now we're gonna move on to the neck. Okay. So we can see the neck and the head are midline to the body. The accessory muscles are even and symmetrical. For the landmarks of the thyroid, we have the hyoid bone, we have the thyroid cartilage, and we have the trachea and the sternomastoid muscles. So I'm going to have you lean your head forward and slightly to the right. With my left hand, I'm going to displace the trachea to the right, and with my right hand, I should be able to palpate the thyroid gland and between the trachea and the sternomastoid muscles. And it is palpable, but no swelling is noted. Okay. And next we are going to palpate the neck nodes. So I'm going to have you turn your face this way. And here we have the preauricular nodes. A little more. Okay. Preauricular nodes. The posterior auricular behind the ear. The occipital behind the head. And then we have the submental under the chin. The submandibular under the jaw. Then we have the jugulogastric. Then we have the superficial cervical. Then the deep cervical chain. Then the posterior cervical. And the supraclavicular above the clavicles. And the lymph nodes are slightly palpable, they're firm but movable and non-tender. Now we're going to check the pulsations of the carotid artery. And the pulsations are about +2 bilaterally, but there's no visual pulsation of the carotid when the patient is sitting up. So now we're going to auscultate the carotid artery bilaterally. We're going to use the bell of the stethoscope. We'll have the patient turn their head to one side and inhale and exhale and hold it. And at that time we can listen. No, just hold the exhale. And turn your head. And inhale and hold the exhale. And there is no bruit noted. Okay, so now we're going to check the heart and the vascular assessment. The patient can be sitting up at this time or supine. We will be doing it in a sitting position. At this time, we would have the patient expose their chest and provide privacy for the lower portion of the body. So we can first palpate the radial artery bilaterally by having the patient stick out their wrists. And you should use your index finger and your middle finger. And the pulses are strong and bounding at a +2, and they are equal bilaterally. Okay. Now we're going to auscultate the 5 areas of the heart sounds. This is done with the diaphragm of the stethoscope. Here we have the aortic, the pulmonic, Erb's point, tricuspid, and mitral. And we can do the same with the bell, the aortic, pulmonic, Erb's point, tricuspid, and mitral. And there's a normal sinus rhythm noted. Then we can hear the S2, which is best heard with the diaphragm of the stethoscope at the apex of the heart. That's the S1, that's best heard in the apex. The S2 is best heard at the base of the heart. And S3 and S4, if they are there, they're best heard with the bell at the apex of the heart. So for this patient, there are no irregular heart sounds noted. Now we can do the chest and lung examination. So we're going to start with the posterior of the chest. So I'm going to have the patient stand up and turn around. So here we see the chest is symmetrical. The patient will be exposed at this time. Symmetrical, and the ribs are sloping downward. The patient is in no apparent respiratory distress at this time. Now we're going going to percuss the posterior lung fields. We start at the top. So there is redness noted, and that is typical of healthy lung tissue. So other areas that can be percussed are the anterior chest or the lateral. Now we're going to percuss the costal vertebral angle and check for any tenderness. We're going to put our hand right over where the kidneys would be and use our fist and lightly tap. Okay, any tenderness? Okay, perfect. So now we're going to check for tactile fremitus. And we're going to have the patient say blue moon or 99.
99. 99. 99.
Okay, one more. Okay, so normal fremitus is noted. And now we're going to auscultate the posterior lung fields. So every time you feel the stethoscope on your back, just take a nice deep breath. Okay, perfect. So normal lung sounds are heard there. And now we're going to auscultate the anterior lung fields. So I'll have you turn around again. Okay. And at this time we can check the lateral lung fields as well. That was a nice deep breath. Okay, perfect. So normal lung sounds auscultated in the anterior and lateral lung fields bilaterally as well. So now we're going to move on to the abdominal assessment. We're going to have the patient lay down on the exam table. At this point, we would have the patient empty their bladder to make sure that we can have a proper assessment. And we would provide privacy for the patient and have them exposed in the upper part of the body. Okay. So we're going to inspect the abdomen. Normal variation would be a flat or rounded abdomen. We can get on the level of the abdomen and see this abdomen is rounded. There is even color on the skin. The hair distribution is normal. The chest rises and falls evenly. And there are no lesions or masses or discoloration noted. The umbilicus is midline. There's no redness or herniation on the umbilicus. So now we're going to auscultate in the 4 quadrants of the abdomen. We start in the lower right quadrant, and we work in a clockwise motion. The upper right quadrant, the upper left quadrant, and the lower left quadrant. Okay, and now we're going to also auscultate for vascular sounds. We have the aortic, the renal on the left and the right, iliac, left and right iliac, and the femoral the left and the right as well. So there are no vascular sounds noted, but there are normal bowel sounds auscultated in all 4 quadrants. Now we're going to perform a general percussion. We're going to start also in the lower right quadrant and work our way in a clockwise fashion again. Okay, in the abdomen there's more tympany noted. Now we're going to percuss for the lower liver border. We would start in the lower right quadrant and percuss upwards until we hear a dullness or feel a dullness. And that is right here. Okay, that would be the lower liver border. Now we're going to lightly palpate using the pads of the fingers. Now we're going to do some deep palpation. You can use both hands, the bottom hand relaxed and the top hand pushing down. Okay, do you have any tenderness anywhere?
Yes.
Where?
Here.
Okay, in the left lower quadrant? No, the right lower quadrant, okay. Okay, and we would document that the patient does have some tenderness in the lower right quadrant. And now we're going to palpate the liver, the spleen, and the right and left kidneys and the aorta. So first for the liver, we would place the left hand under the patient's back to support the abdominal contents. And then with our right hand, fingers close to the midline, parallel to midline, we would ask the patient to breathe slowly and perform a deep palpation. And the liver is palpable. For the spleen, we would do a similar maneuver with the left hand under the patient's back, and with our right hand, with the fingers pointing to the left axillary line. And the spleen should not be palpable. Then for the kidneys, we would use both hands in a duck-billed motion. Left hand under the patient's back, and the right hand, and press down. And the same motion for the left kidney. And the kidneys should not be palpable either. Okay, and now at this time I'm also going to check the dorsalis pedis and the posterior tibialis pulses. Since the patient is in a supine position, it's more comfortable to check at this time. So the dorsalis pedis would be on top of the foot. And we would check both feet to make sure pulses are even. And the posterior tibialis would be just behind the ankle bone, right here. And check both. And those pulses are even bilaterally. So at this time, we're going to have the patient get dressed. Oh, no, we're going to palpate the aorta first. So the aorta would be just left of the midline. We can use our index finger and our thumb. And the aorta is palpable. So at this time, we would have the patient get dressed and sit up for the neurological part of the assessment. So first we're going to check the cranial nerve 11. We're going to have the patient rotate their head towards resistance. To the left, okay, and then to the right, okay. And now shrug your shoulders against the resistance. Okay, very good. Now we're gonna have the patient demonstrate fine motor and coordination. We're gonna have you pat your knees and alternate palms up and palms down. Very good. Now the finger to thumb test. I'm gonna have you touch each finger with your thumb. Okay, very good. Now we're going to have you touch your nose. Now touch my finger, back and forth. Okay. Okay. And the patient is showing very good coordination, and the coordination is intact. Okay. And now we are going to try the heel to shin test. So if you have the patient raise their leg and put their heel to their shin and go up their shin and down. And now the opposite leg. Okay, very good. And now we're going to test for the bicep, patellar, and Achilles reflex. The bicep reflex, you can have the patient relax their arm. You can place your 2 fingers on their bicep tendon, which would be right in the antecubital space. Then with a reflex hammer, you would press on your own on your own 2 fingers. And you should elicit a response from the bicep and the arm. Now we're going to try the patellar reflex. We're going to have the patient relax their leg, and you would hit right below the patella, and you would see their leg give a kicking movement. And the Achilles reflex is the back of the foot, and you would have them relax their leg and essentially hit the back of the Achilles tendon. Okay, very good. Now we're going to have the patient sit on the exam table to assess the sense of the position sense of great toe and vibratory sense of the great toe. Or you can just put your feet up. Okay. So with this test, you would grab the patient's great toe and you have them close their eyes, and they must tell you what direction you're moving the toe in.
Left, right, back, forward.
And the same for the other toe.
Right, left, back, forward.
Okay. And to test the vibratory sense, you would use a tuning fork. Since we don't have one, we would pretend, and we use a tuning fork, hit it on our hands, create the vibration, and place it on their big toe, and they would be able to sense the vibration on their feet. Okay? And now we're going to have you stand up for the final part of the exam. Okay, so just a little farther back. Okay, so we're going to do the Romberg sign test. Have the patient stand still. Be there to support them if they do sway or fall. Close your eyes. And have them stand with their eyes closed. And you can even have them lift the leg and keep their balance. Okay? Perfect. So it's a negative Romberg sign. Then we're going to have you walk back and forth to assess how you walk. The gait is steady and balanced and effortless. There's opposing arm movement with coordination. Okay? And then when you walk back, just have them walk in tandem style with one foot in front of the other, heel touching your toes. Very good. So the tandem walking is balanced and straight. So this would conclude the head to toe assessment. Thank you so much for participating.